Many seem to think that health insurance in Germany is free. It's not. Together with your employer, you pay about 15% of your salary for health insurance. Public health insurance, that is. And some of you seem to think that families and kids are insured for free as well. Maybe. It depends. That one can be right, can be, not automatically for everyone. Let's see under which condition your family will get free healthcare in Germany in this PerFinEx health insurance video. We don't really like the public health insurance a lot on this channel. We don't like anything actually that the government touches, but the free family insurance of the public health insurance is really good if you get it. I must admit that. That is the one big selling argument for public health insurance, that your spouse and your kids might be insured for free under certain circumstances. You can read them in detail in paragraph 10 of our Social Code 5. For everyone else that doesn't want to go through legal German, here's an easy explanation. As easy as it can be. Nothing in Germany is easy, but at least we can try. Let's talk about adults first before we bring kids into the picture. If both adults are working, either as employees or self-employed, both will have their own health insurance completely independent of each other. Meaning also both will pay for their own health insurance. So nobody is insured for free here. If any one of the two adults is earning more than 66,600 euro gross salary per year in 2023 or is self-employed, they have the freedom to decide if they want to be a member of the public health insurance or the private health insurance. Earning below 66,600 euro in 2023 will force you automatically into public health insurance. If you want to know if public health insurance or private health insurance is better for you, there are a lot of videos on our channel already, so we can skip that here. Or you book a free meeting with us and let's have a conversation what makes the most sense for you based on your individual situation. If you are married and only one of you is working while being in the public health insurance, either voluntarily or as a forced member, doesn't matter in that case, the other spouse can be insured for free if they live in Germany, they are not self-employed, and they earn less than 500 to 600 euros if they are employed. The exact amount depends on your tax situation, so check that with your public health insurance when applying for family insurance. A 520 euro mini job would be alright. You can get free family insurance with that. If only one of you is working while being insured in a private health insurance, it depends if you are married or not. If you are married, the non-working spouse can also become a member of the private health insurance. It doesn't have to be the same plan as the working spouse, but it helps if it's the same private health insurance company. Again, let us know if we can help you select the right private health insurance for you guys. If the non-working spouse is in public while the working spouse is in the private health insurance, the non-working spouse has to pay for public health insurance based on half of the married couple's earnings. Because in the public health insurance, your premium is based on your earnings. The percentage is the same that employees pay, so about 8% up to the maximum of about 450 euros a month, depending on how much you earn as a married couple. Last possibility for two adults, before we talk about kids, only one of you is working and you are not married, just in a relationship or something. In that case, it doesn't matter if the working spouse is in the public or the private health insurance, because it is extremely tough to get private health insurance for your non-working boyfriend or girlfriend. So public health insurance may be the only option. While you had half the married couple's earnings above to calculate your public health insurance premium, when you are just in a relationship, the premium is about 15% of fictional earnings of about 1,100 euros a month, so about 170 euros. Based on these examples, you can see that it's not so easy to get free family insurance. Only in 1 out of all cases, your partner might be insured for free. Now, what about kids? Oh boy, this is gonna get complicated. If both parents are working and both are insured by the public health insurance, the child can be insured free of premium in the public health insurance as well. Or if you want your child to have the best health insurance possible, you can enroll your child into the private health insurance while both parents stay in the public health insurance. Private health insurance for a child is usually 150 euros a month until they're 18 or 21 years old, depending on the insurance, and your employer might pay up to 50% of the kid's health insurance premium, depending on your income. Your child will thank you for that because he will pay an extremely low private health insurance premium for the rest of his life when you enroll him as a baby or a kid. If both parents are working and one is in the private health insurance while the other one is in the public health insurance, then the child will be insured with the highest earner. Every once in a while we have someone that wants to be privately insured himself while the spouse and the kids shall stay in public, which I find extremely questionable from a moral perspective if you want better healthcare just for yourself and not for your loved ones. But whatever, this is a finance channel and not a morality channel. Not possible, because kids are always insured with the highest earner. If only one of you is working in the public health insurance, the spouse and the child might be insured for free if the conditions apply that we discussed earlier on. They're in Germany, they have no income, etc. If the working spouse is in the private health insurance, the non-working spouse can be in private as well or stay in public. We discussed that earlier. No matter what the non-working spouse does, the child will be insured in the private health insurance, because why? Children are always insured with the highest earner. Last possibility, parents are not married and only one is working. If the working parent is in public, the non-working parent has to pay for public health insurance as well. We discussed that earlier. And the child can be insured for free in the public health insurance or go private while both parents stay in the public health insurance. We discussed that earlier as well. If you are not married and the working parent is in the private health insurance, the non-working parent has to be in public. It stays the same as earlier. And the child is? I'll give you a hint. The child is always insured with the highest earner. So private if the working parent is private as well. That should cover all possible constellations, or did we forget anything when it comes to families and their health insurance? If so, then let us know in the comments. And if we can help you select the right health insurance, then feel free to reach out. Stay healthy and take care, everyone.